This is an advertisement for NeuroRounds. You should come. You're going to learn something, and your chances of getting into medical school are going to be dramatically increased because almost everybody that went to NeuroRounds got into medical school, right?
Right. Or nursing school, or PA school, or pharmacy school. Most pre-health majors or aspiring pre-health career choices come to our NeuroRounds, which is this coming Tuesday. I'm going to have to look at the date.
I think it's August 1st.
I think you're right, August 1st.
Yeah. That's a good point because you don't have to be a doctor to go to NeuroRounds. It's a clinical hour of experience that you can log, you can get credit for, and there are real patients, real scenarios, and it's the best way to learn, the Socratic method.
I will attest to that because as I have done NeuroRounds, joined NeuroRounds as a pre-med student, and now as a medical student, you learn a plethora of information on how to read studies, philosophy behind medicine, how doctors work together, how doctors think, how doctors work with their teams of nurses, PAs, PTs, etc. I had a question for Dr. McLaughlin because he started NeuroRounds in a different fashion years ago, and then we kind of altered it a little bit during COVID. What was your goal for starting NeuroRounds? And when did you?
It was for improvement. It was to discuss patients and protocols and ways we take care of patients. It was initially a training session for our PAs in the office to make sure that they knew the ins and outs of routine neurosurgical issues, some of which are emergencies and some of which are more mundane issues that come up. But we talked about how to work up a shunt. What are the possible complications of a shunt? What do you need to be thinking about? How to build your differential diagnosis. How to think of 3 things that you're not thinking right now so that you can, broaden your breadth of what's going on to try and figure out what's going on with the patient. Basic workups for cervical stenosis, for lumbar stenosis. Basic workups for treatment of disc disease. Really, it's for training. It's to get better.
And for me, in the beginning, it was always a little awkward to step out of your comfort zone, but as the years have gone by, it becomes like Dr. McLaughlin says, like riding a bike, asking questions. And as we've all heard since we were young, there's never a stupid question, especially in medicine. So we highly encourage you to come, join. We love to see everyone's faces, new people, old people, and it's a lot of fun.
Jordan Peterson says that life is punctuated by painful bouts of learning. This is the most painful bout of learning you could have because it's good-natured and you can just say what you're thinking and be confident with what you're speaking, and you're not going to injure a patient, you're not going to harm anybody, and you're going to learn.
And they're real-life patients too, which is really cool to see when you're a medical student, maybe before your 3rd or 4th year, that you've never seen, and it brings to life the book work that we do. And one last thing, highly encourage you to comment or share this with other people because we want to know what you want to learn and what you want to see. Of course, Dr. McLaughlin is neurosurgery, but we do have orthopedic surgeons, we have pediatric neurosurgeons, we have doctors from all over the country and of different specialties that we can present cases. So your interests, we would love to hear, and we'll do our best to accommodate.
See you on Tuesday morning, 7 a.m.
7 a.m. Eastern time. That might be the only painful part of it for some people.
Good.